Alright, so now we're moving on to chapter 12. This is one of two super short chapters in the textbook, 12 and 13. This one is dealing with the eye, and the other will be dealing with the ear. Because of that, there's a lot less words in the chapter, so that's kind of a good thing, right? Alright, so the first thing we're going to do, similar to all other chapters, is just go through and figure out what are the basic structures of the eye, what does it look like, how does it function, so that we can then get into what problems can occur. So, I feel like you should know this, but the eyes are the organs of vision, and it is located in a bony kind of cavity. If you think about the skull and the openings in the skull that allow for your eyes to be located, that's called an orbit. And really, of the entire surface of the eye, only a very small portion of it is actually seen from the exterior. This is what it looks like from a side view. You can see zoomed in there on the bottom a little bit for the lens area and all those multiple layerings that go over that. We're going to kind of run through all those different structures, but you can kind of see all of that in the beginning here, and then there's this large fluid-filled space all the way back to the optic nerve that's going to carry those sensory images back to the brain for interpretation. Okay, so first up we have the sclera, and in looking at this picture, it's kind of hard to tell because they label it way back here, but it's the protective outer layer of the eye. And the picture's not really representative, but you can see it kind of wrap around here and kind of come down here as well. It's this gray thing down here at the bottom a little bit. It kind of feeds into what we'll see as the cornea. And when you're looking at your eye from outside, it's the white part of the eye. That white part is that outer protective layer called the sclera. We do have a cornea. You can see on the picture here the gray section of the sclera kind of wraps around, and then it transitions to this clearer part. That clear part that continues all the way around back to the other portion of the sclera, that is the cornea. And it's transparent, obviously, so that you can see images coming into your eye, but that's its purpose. It is considered part of the sclera, but it does allow those light rays to enter into your eye. And it's that outer protective layer, so it is possible if you've ever scratched your cornea, it hurts a lot, but it's not necessarily damaging your eye because it's that protective outer layer. There's a middle layer called the choroid. Here it's pictured in blue. It's just another layer. In this case, this is the blood vessel infused layer that is going to give oxygen and nutrients to the eye. We have the iris. In this case, it's here in kind of a darker blue, located right here and right here on the bottom picture. You can see it kind of feeds up from the choroid. The iris is that pigmented color, so it gives you basically the color portion of your eye. Depending on what eye color you have, that's the type of pigment associated in it. But it is a muscle. It does regulate kind of how much light goes into your eye because it expands and contracts to control the size of the pupil. And the pupil is in the center. It's just a hole. So it in and of itself is just a hole where the light comes in, and then depending on the atmosphere or environment you're in, the iris will expand or contract to make that hole bigger or smaller to allow more or less light in. Okay, next we have the lens. The lens is that big, what kind of looks like a contact in the middle of your eye. It's this chunk right here. And it sits right behind the pupil, so when light comes in through the pupil, it hits the lens, and that lens is responsible for focusing that light and bending it so that it can go towards the back of the eye. That's its job. And when that's not shaped properly, then you can get all kinds of vision problems. The retina is the innermost layer of the eye. And most people think that it's only centered on the very, very back of the eye, but it really goes around the entire inside here. And that's where your vision receptors are. So that light can stimulate those receptors and then trigger sensory information, so to speak. those receptors will then send impulses to the brain to say what you're seeing. There's two liquid portions of the eye. They're called humors. We have the aqueous humor, which is in the front here. That is in what they call the anterior cavity. But it basically helps keep your eye shaped correctly up here. And then the bulk of the fluid is back here behind the lens. That's the vitreous humor, and that's the jelly-like fluid. Its job is to just basically maintain the shape of the eye. Think of it as a water-filled balloon, kind of. If there's no water in there, then you can't maintain that shape. But you can also imagine, just like a balloon, if it's over or under inflated, we can have different kinds of medical problems. All right, there's a couple other things. Meibomian glands. I don't really think that I'm going to actually require you to know that, but they are oil glands, and really they help secrete oil to the eyelids and help lubricate the eye. So if you have too much or too little, oil secretion, you might potentially get an infection, but that's what that is. I don't think it's pictured in the picture. Lacrimal glands and ducts, those are your tear ducts. So in looking at this picture, you can't see, but if you think about the inner portion of your eye where those tears come from, and then there's kind of a little tube where they might drain, there's some better pictures in your book that showed that portion on page 468 if you want to take a peek. The optic nerve is at the back of the eye, and that kind of collects all of the visual impulses, all of those receptors on the retina that have been activated, then send those impulses from the retina to the brain. And then finally on here we have the conjunctiva, and that is a mucous membrane. Again, you can't really see it nicely in this picture, that lines the eyelids. So think of it as that membrane on the inside of your eyelid. And whenever you close your eye, it's going to fold over the sclera and then go over the cornea when you close your eye. And it's funny to think, but when you get things like pink eye, it's really an infection of the conjunctiva that gives you those pink eyes, because it's on the inside of your eyelid and covering the sclera. So that is what gives you that issue. Okay, so here's that better picture of kind of just the tear ducts or the lacrimal glands. You can see that there's one that in this picture looks like a tiny brain secreting tears from the top. And then there's one over here. So this is like that little bump that you might notice on the inside of your eye here. And that's really where drainage occurs. And what's interesting to see is that drainage goes down into your nose, which is why if you cry a lot, your nose tends to run, because those tears are going down into your nose. When this gets clogged up, that's when you get all that like crusty gunk buildup in your eyes when you're sick, for example. If that's not working properly and your tears can't drain, that's one thing that can happen. This is the general pathway of light, so just to give you kind of the rundown of what happens when you actually are seeing something, where the light is going. So it always starts on the cornea, because that's your kind of outermost protective layer. It goes through that first liquid portion, the aqueous humor, through the hole of the pupil, bounces on the lens, and then that lens is going to focus and direct the light through the vitreous humor fluid all the way back to the receptors on the retina. That information is collected and then sent from the optic nerve to the brain. I'm not going to expect you to know the specifics of what's going on in the brain, but you have a visual cortex in your thalamus part of the brain. From the thalamus to the visual cortex of the occipital lobe of the brain. And that's where the visual information is then interpreted for you to actually understand what you're seeing. That was a lot, so just make sure you're feeling good about all those different layers and all those different parts, because now we're going to actually apply medical terms to it. Here's the list. looking at this, the diagrams are also found in your book on 470, 471 if you prefer to do it there versus writing it on a separate sheet of paper. But we have blepharo. The PH sounds like an F, just like in phone. That is the fancy word for your eyelid. So for example, if you have blepharitis, your eyelid might be inflamed. Conjunctivo clearly goes with your conjunctiva, so that mucous membrane on the interior of the eyelid. So conjunctivitis, for example, is the fancy way to say pink eye. In this chapter, there are 3 words that pretty much all mean the same thing. Pupil. Pupillo is going to be the easiest one to remember for pupil, just because it sounds the same, but we have coro with and without an E. So you could say coro, corio if you would like, and pupillo. Please note that the word pupil has 1 L, but when you create a combining form for it, we have 2 L's. Cornea. Here we have corneo, which makes sense, but that's another reason why spelling matters, because without an N, it's coreo. With an N, it's corneo. And we also have kerato, but be a little bit careful because we already did learn from our super awesome chapter 4, kerato can mean horny tissue, but in this case, it could potentially mean cornea. So it just kind of depends on the context of what it is that you're talking about. Dacryo and lacrimo are tears. So I traditionally use lacrimal because the lacrimal glands are the ones that make tears. But we might see that used interchangeably. Irido and iro both mean iris. So if we remember back to what the iris portion was, that is going to be the pigmented color portion of your eye, controlling the pupil. So if there are maybe muscle contraction problems in that area, we'll see that. Oculo and ophthalmo both means eye. So think of ocular, binoculars for that form of eye. We also have ophthalmo if you're going to go to an ophthalmologist. It's really hard to pronounce and it's really hard to spell. So remember O-P-H-T-H-A-L-M-O. One of the most misspelled words probably from the book. Opto means vision. So the optometrist is another person that you might go to. So there is a clear distinction. Oculo and ophthalmo really have to do more with the structure and function of the eye itself and eye anatomy problems, whereas opto and an optometrist would be focused more on vision. So that would be the person you go to for contacts and glasses. That's not the person you would go to if you had a sty or glaucoma or something other than, you know, a standard vision problem. Next we have Paco and Paco. They both sound exactly the same. One's with a C, one's with a K, but they are related to the lens, which is that part responsible for focusing the light as it comes in through the pupil. Retino means retina, pretty self-explanatory. Same thing with sclero and sclera. So take some time to just kind of label these in the eye, and then again think about what are the functions of these different parts and what might be able to go wrong to give you a medical problem. All right, now we get to the combining forms. So the first one we have here is cryo. I always think of cryogenics. I don't know why, but it means really cold, or cryo freezer. It'll come into play a little bit later. We'll talk about. Cysto, you've already known for a while, means bladder. But it also generalizes a little bit more to mean a sac. So when we're talking about this, we might see it in context describing the eye kind of as a sac in the middle of a term. Diplo means 2 or double. So often we might see this in the sense of you might have double vision. ISO means equal. So if you have equal vision in both eyes, we might use ISO. Photo means light. And then tono means pressure or tension. And I think of this in the sense of that water-filled balloon analogy. If you have too much or too little pressure on the eye, it can cause problems. So that's when we'll see tono. If you have a chance to add this to your diagrams, go for it. Otherwise, there's some exercises on page 472 that would be worth trying. Okay, so before we move on into the actual full medical conditions, we just have a couple of prefixes and suffixes. But at this point, I feel you know most of them. So bi and bin both mean two. So binary, binoculars, all of those things. Suffixes, when we're talking about vision or really a condition of vision, meaning is it good vision, bad vision, what's wrong with it, do you have double vision, you're going to use opia. Phobia means that you are afraid of things. Great. Seems like a general suffix. But in the context of the eye, we're going to use it with photophobia. So if your eyes have kind of an aversion to light, that would be an example of when we would use it in the eye. Plegia, not to be confused with phagia and plasia and all of those other things. Plegia, if we remember, like paraplegia, quadriplegia, means paralysis. So your eyes are muscular in nature, can also become paralyzed. Okay, which one of these is spelled correctly? Hopefully you're saying B. This is that weird one. So we have O, P-H-T-H, A-L-M-O. Ophthalmo. Very true. Okay, to the diseases. There is a lot of them. But these are all from word parts, so take a deep breath and realize that you have learned a lot of these in your midterms life up to this point. Some of them are going to be a little tricky. For example, aphakia. It is chopped up in terms of what it is. A is this prefix meaning without. If we remember, phaco means lens, and then IA means a condition of. So we have a condition of without a lens. That would be most likely a congenital problem that you're born without one. It could also mean that the lens is removed because you have another condition, for example. Otherwise, we have a lot of itises. Like I said, blepharitis would be eyelid. Conjunctivitis would be inflammation of the conjunctiva or pink eye, and other instances. Ptosis is a suffix that we've seen before. Ptosis means drooping. So whatever it is that you're talking about is sagging or drooping in some way. So here's an example of the eyelid drooping. So that would be blepharoptosis. Blepharoptosis right here. We do have a lot of vision things. So you might see opia. So diplopia would be double vision. We have ones that we'll see later on too. Let's see. Plegia, again, means paralysis. So if I'm talking iridoplegia, that would be paralysis of the iris. And if we remember, the iris is that pigmented muscle that controls how much light goes in through the pupil. So if it can't do its job, then you can't expand or contract that pupil. Malacia is softening, if we remember. So keratomalacia would mean that the cornea is softening, which can lead to all kinds of problems. Here's a weird one that we might see. Leukocoria. So leuco, if we remember from a long time ago, means white. Coro means cornea, and ia. So in this case, we would have a condition of a white, I meant to say coral meant pupil, not cornea. So this would be a condition of a white pupil. Algia, if we remember, means pain. So ophthalmalgia, that is a mouthful and a tongue twister, would mean that you have pain in your eye. So if they don't know what's wrong with you, you just have general pain. It can also be paralyzed in terms of the muscle being paralyzed. Retinoblastoma, if we remember, oma is a tumor, so this is a very common tumor of the developing retinal cells. Let's see. Otherwise, I think you can figure out the rest. If you want to take a break from continuing on in the PowerPoint, now would be a good time to try exercise 9 on page 476, or the harder version on 474. All right, here's another one. This is an extreme version, but it is a fairly common thing to happen. So inflammation of the tear sac. Thinking about what tear means, what sag means, what inflammation. Oh, it's not giving you the answer, but we would say lacrimocystitis is one thing that we would be able to say. You could also say dacryocystitis. They both mean tear or sac. So in the book it's going to say dacryocystitis, but you could potentially use lacrimocystitis too. Okay, so this, if you think about, those nasty crusties that kind of come on your eyelashes when you are sick, point to an eyelid inflammation. So this would be B, blepharitis, inflammation of the eyelid. And then that yields those little crusty bits that come on when you're feeling sick. Okay, there's a ton of words not from word parts. So here we go. The first one is what we would call a lazy eye. It's called amblyopia. So again, we have opia in a lot of these terms, even though they're not built from word parts. So that'll help guide you in understanding that has something to do with vision. So amblyopia means that you have reduced vision in one side. Really what that means is one eye is stronger than the other, and if you don't correct it, the stronger eye gets stronger and the weaker eye gets weaker. So that's when you might see young children with patches over their good eye, kind of forcing them to use their weak eye until vision is equal again. All right. Next we have anisometropia. Significant unequal refractive error between two eyes. So when we think about how the light bends from the lens to the back of the eye to interpret it, it just means that both eyes are doing it differently. They're unequal in how they go about doing that. So that can lead to different vision in two eyes. Astigmatism, common thing to hear if you have glasses. It just means that either your cornea that the light travels through or the lens travels through, the curvature isn't quite smooth enough, or it becomes irregular. And then that refraction is not as clear. So then you get kind of a little bit more of a blurry vision and can't focus quite as clearly. That's what astigmatism is. Cataract is a lens problem. You think of it with old people, but basically the lens starts to cloud over, which is a problem if it's supposed to be taking in the light and bending it towards the back of the eye. Chalazon is a problem with the oil gland in the eyelid. So it's an eyelid problem, but it's not an infection. It is a blockage of something. So it's some kind of blockage of your oil duct in your eyelid, but it's not caused by an infectious bacteria or anything like that. Drusen is yellow deposits. You might see these under the retina. Well, you can't see them from the outside, but they're on the inside of your eye underneath the retina. And it's just a normal thing that might occur with age or another condition that we'll get to in a minute, macular degeneration. Glaucoma, I feel like that's another old people thing you might think of. But this has to do with the eye pressure. So the intraocular pressure, think of the vitreous humor and aqueous humor. If that intraocular pressure, meaning inside the eye, or IOP, is increased for some reason, then it could potentially at some point cause damage. And so you need to be on top of reducing that pressure to keep your eyes fully functional. We have hyperopia, which is the fancy word for far-sightedness. So what that means is when the lens goes to focus the light, it does so kind of behind the retina, and therefore you have trouble seeing things close up. You can see things far away just fine, but you have trouble looking at things up close. That is the opposite of myopia. Myopia means nearsightedness, so that one's over here. So you can see things near but have difficult seeing things far away. Hyphema is basically a hemorrhage or an issue. You got hit in the eye is most likely what happens, and then you have some kind of hemorrhage in the eye. Macular degeneration is a progressive problem, so this happens and could eventually lead to blindness. Usually this happens in people like 50 or older and can progress until blindness. But the retina itself starts to degenerate, and it's called the macula, the special part of the retina, which is why it's called macular degeneration. But it won't be able to then collect all those images and send it to the brain. So once your retina deteriorates or the macula part deteriorates, then you won't be able to send any messages. And so you kind of see this black hole in your vision, and it gets bigger and bigger until you're eventually blind. Nyctalopia, again, has to do with vision. Nyctal means night. So nyctalopia means that you basically have trouble seeing at night, or this might be called night blindness. It also occurs too, some people in the sense of night blindness get really blinded when headlights are coming near them and they're driving at night. That kind of is lumped into that category. Nystagmus is when you have involuntary jerky movements. So if you've ever seen someone and their eyes look like they're kind of just fluttering back and forth left and right, that's called nystagmus. It's just a condition that they have. It could be congenital, genetic. Pinguecula, we're getting into some crazy terms now. This is something that can occur when you're out in the sun too long, and why you should probably wear sunglasses. It also occurs in dusty areas too. But it's a yellowish mass that kind of can grow on the conjunctiva. It's that inner membrane lining of the eyelid. So if you're out in the sun a lot or in dry climates, dusty areas, it can eventually spread throughout the eye and become a different term that we'll get to. Presbyopia. Presby basically means old age. So we should know that as we get older, our age starts to go or get worse, decline. This happens with hearing too. So basically when anything declines over age, we use presby in the first part of the word. Pterygium is this one here. The P is silent. Pinguecula can turn into a pterygium. And this is basically a thin tissue growing onto the cornea. So if you have that initial growth or mass, it can eventually spread through the entire conjunctiva and cause problems. Retinal detachment is exactly how it sounds. Your retina is physically detached from the back of the eye, whether it's from trauma or disease or something else. The choroid is that outer layer, so the inner layer of the retina becomes detached in some way. It doesn't mean necessarily that you're going to go blind, but you need intervention very quickly. Retinitis pigmentosa is a hereditary problem that comes along with a lot of things. So there's night blindness, your eye begins to atrophy, the pigments start to change, so your colors start to change. There's a lot of different pieces to it. Strabismus is a fancy word for cross eye, which is not the same thing as a lazy eye. Strabismus means when your eyes are looking in different directions. And it's really a muscle problem, generally. The muscles can't keep the eyes focused straight. Lastly, we have a stye, and that's when the oil gland of the eye is actually infected. And you can see a little bump on the eyelid. That would be a stye. Whereas if it's, again, a bump not due to infection, just an obstruction, that was what the chalazon was. These are a lot of confusing terms that don't necessarily sound anything like what they mean. So please take some time to really go through exercise 13. It gives you some really good pictures of a lot of these things to help figure out what the actual difference is between a lot of these. So here's that difference between nearsighted, farsighted, and astigmatism. So nearsighted is myopia, and you can see when the images come in, they bounce off the lens, and that focused image is before the retina. So normally your image in a perfect world would be having an X right here on the back of the eye for the retina, but it does it too early, so that limits your ability to see things far away. In the opposite condition, hyperopia, it then does it towards the back of the eye. And last but not least, we have the astigmatism, and so this is where your eyes create kind of a little bit of a fuzzy image because one eye is focusing too early and one is focusing too late, so then you get that kind of blurred picture a little bit. Okay, so here are some of those pictures from the book in that exercise 13. So a cataract, again, you can see is a clouding of the lens there, so this is completely obstructing that person's view. The chalazon, so this is a bump here, again, not as a result of an infection, but as of a blockage. And then if it is a result of an infection, you can have something like this, which is a stye. And these things kind of wear away on their own. I'm sure there's antibiotics or whatever you could take. I've had one before, other than the fact that it sucks and it's a little bit painful, you're fine. And then you can see here on the left, again, back to the cataract piece, this is how it starts. This is kind of a snowflake one, and then this would be a full-on coverage of the eye. You can see this in dogs a lot if you look into their eyes, and you can kind of see it's a common problem with them. Fun fact, I guess. Okay, here's the graphic of what a detached retina looks like. Again, the retina is the interior lining, so if that pulls away from the wall of the eye, then we have a detached retina, which is a problem because then this is not pulled tight enough to be able to focus the images that you need. And this could have been caused by disease, impact, all kinds of other things. Macular degeneration, here's kind of that general picture of what that looks like. Again, that part of the retina called the macula starts to deteriorate. And then as a result of that, your vision starts to fade over time. Okay. Moving on to surgical terms. There's not a whole lot, so that's good. These ones are built from word parts, so we just kind of have to remember our suffixes here. So plasty is going to be surgical repair. In this case, you're repairing the eyelid. Or down at keratoplasty, you're repairing the cornea. And that's interesting because this over here in the right image is a picture of a keratoplasty. I could have also said corneoplasty because they mean the same thing. But A transplant fits in that category too. So there are instances of where a person might have their cornea transplanted, and you can kind of see the black stitches. It'll heal on its own over time. You can see the sclera is not very happy around the eye right now, but it'll eventually get better. Pexy. Pexy is a word, I can't remember if we've seen this suffix before, but it's surgical fixation. So cryoretinoplasty means they're fixating the retina using cold. It seems crazy, but they can actually do that. Maybe this is for a retinal detachment, for example, and they're using cold to basically glue it back or fix it back in place. Decurocystorynostomy. As I mentioned before, the tear duct connects down to the kind of nasal passage, and that's where the drainage occurs. So if there's a blockage in that drainage system, then we need to create an artificial opening. Or thinking about expanding the current drainage tube so that it can drain. So that's why we have ostomy here. So whenever that happens, this happens with little kids a lot too. If they get that eye, I call them eye goobers for my 4-year-olds, but if they get that kind of buildup in the interior portions of your eye on a regular basis, they just kind of go in and reinforce that drainage system so it's not a problem. Ectomy, again, means removal. So in this case, an iridectomy would be removal or excision of part of the iris. Or if you're just cutting into it, you'd have otomy. So take some time. There is an exercise 17 on page 483 that covers that. Thankfully, the not for more parts list is not as long as the diseases not for more parts. Some of them might be something you've heard of before. Enucleation just means, it's weird, you're removing the entire eyeball, or really it's a general term that can apply to removal of any whole organ, but they put it here because the eye is one thing that is easily removed intact. LASIK is an acronym. It stands for Laser Assisted In Situ Keratomiliosis. Crazy long, so we call it LASIK. That's the laser eye surgery. I actually had this done, God, I don't know, 10 years ago. One of the greatest things I ever did. But what happens is your cornea or your lens is slightly misshapen, and that's what leads you to need contacts or glasses in the first place. So in this procedure, a laser basically comes in and zaps your cornea and shapes it to the correct curvature, and therefore then you don't need glasses anymore. This doesn't work for everyone. You have to have a thick enough cornea, and it has to be a shape problem that gave you your eye vision issues in the first place, but it oftentimes can correct astigmatisms, hyper and myopia. And this goes a little bit below the corneal surface. So there's going to be another procedure in a minute that's really on the surface of the cornea. The LASIK goes underneath the top layers of the cornea. And really, it's like a 5-minute procedure. You're awake the whole time. If you ever want to know more about it, you can ask. The next one is called phaco, or phacoemulsification for the long version. This is to remove cataracts. And remember, cataract is that clouding in the eye. So this is where they basically use a needle to poke it around in that cloudy portion and break up that cloudy patch. So the idea is if you can break it up into tiny little pieces, it'll help restore your vision. Next we have PRK, which is photorefractive keratectomy. And this is really, again, to correct vision issues using a laser, with the sense that in this case they're either flattening or removing a chunk of the cornea. So this is where they might work on the surface layer of the cornea versus going deeper underneath. I don't know if one PRK versus LASIK, if one is more preferred versus the other, if one's more expensive than the other. I feel like LASIK is a little bit easier and quicker. Next we have retinal photocoagulation. And this is where you use a super intense beam of light to seal any leaking blood vessels or zap any abnormal tissue that you might need. So the idea is, if you think about your blood coagulating, it kind of clumps up. So if you have bleeding issues in the back of your eye, or you have small growths in the back of your eye, there's a super intense beam of light that basically zaps it. So you don't actually have to cut into the eye or anything. They're just using light beams to kind of fix the problem. Scleral buckling is a specialized procedure for retinal detachment. It's basically a strip of cornea is made, or a fold is made in the sclera, and they basically put a giant rubber band on your eye to hold it in place. The idea that eventually your retina can maybe begin to reattach or seal back onto the layer, but it's a little rubber band for the eye. Trabeculectomy is surgical creation of an opening. Basically, they're going to go in and create a tiny little hole underneath the conjunctiva where a lot of the aqueous humor that might be causing glaucoma or increased pressure is the problem. So by creating this tiny little hole, you will then remove the excess fluid and release the pressure. Vitrectomy is something very similar. You basically take a giant needle, put it into the eye, and remove directly the vitreous humor. It's kind of a more extreme version of a trabeculectomy. So go ahead and try exercise maybe 21, exercise 20. There's matching on page 485 and 486 to kind of get those terms in place. Then we are going to move on to diagnostics. Here's an example of what that PRK and LASIK looks like. So historically, they would usually use a laser to kind of create a little flap and then peel back the cornea so they can access the eye, which is pretty cool. And then when they're done, they just put the little flap back, and then it'll seal itself in a couple days. Diagnostics. Okay, so in terms of diagnostic imaging, there's really only one. It's called fluorescein angiography, and we'll learn a little bit more in depth later, but angiography basically means that you're imaging the blood vessels. In this case, we're using fluorescein dye to look at the eye. So they put a little bit of dye in the eye to look at the blood vessels there to see what's going on. In terms of evaluating the anatomy and function of the eye, we have a lot of ophthalmic evaluation tools. Whether you're going to measure with a meter, which is an instrument used to measure. Otherwise, we have scopes to look during the procedure of scopies. When you are measuring, that's when we have metry. So we're looking for a couple of different things. So a keratometer is going to measure the curvature of the cornea, which is important when you're figuring out and fitting contacts to a person. When you're doing ophthalmoscopy for an ophthalmoscope, that's when you're looking at visual examination of the eye. And so that's when they have that little kind of black handheld light at the end thing. I think I have a picture of it. If not, it's on page 487. Optometry is measuring your vision. So an optometrist does optometry. So that's when you go to the eye doctor to read the letter chart and have the little thing come down in front of you and they say 1 or 2, 3 or 4, that kind of thing. Pupillometer and pupilloscope, those things are looking at the diameter of the pupil and just making sure that it is shaped correctly, working correctly. Same thing with retinoscopy to look at the retina itself. And then tono means pressure. So a tonometer is going to measure the pressure in the eye. Thinking about things like glaucoma with increased pressure, what that looks like. So which one of these would be done in an ophthalmologist's office? Really, it's hard to say. So enucleation, definitely not, because that's kind of a full eye removal surgery. Tonometer measures pressure. You would definitely want to do this in an ophthalmologist's office. Retinoscopy is generally done by an optometrist, but when an ophthalmologist is looking at the general, structure function of the eye, they could do retinoscopy too. Okay, we are now to complementary terms. So we're a couple lists away from the end, thank goodness, right? Complementary terms. We have anisocoria, which means your pupils are not the same size. So an means not, iso means equal, cor means your pupil, and ia. So that's how we break that down into parts. So you have a pupil that is not of equal size. Binocular, pertaining to both eyes, so that's why we call them binoculars. Corneal, a lot of these have to do with pertaining to. You'll notice, or a condition of blank. So anytime you see IA, that would be a condition of. Intraocular goes within, the eye, so we talk a lot about intraocular pressure. Isocoria means that you have equal pupils, so that's the good thing. Lacrimal, again, pertaining to the tears, so we have lacrimal glands. If you're talking specifically about the nose drainage system, we have nasolacrimal. Ophthalmic means pertaining to the eye, so a lot of times if you have an eye infection, you're going to get ophthalmic drops. And we talked about what an ophthalmologist does, and we talked about ophthalmology, and this is how it's abbreviated, OPHTH. Ophthalmopathy would be any general disease of the eye, not having to do with vision, but having to do with the eye itself. Optic really pertains to the eye. Pseudophakia. Pseudo means false, and in this case, phakio means lens. So pseudophakia means that you have had your lens replaced, or they put in a fake one, mostly to treat cataract. So if your lens gets completely clouded over, that's kind of a treatment. Pupillary, pertaining to the pupil, and then retinal, pertaining to the retina. Take some time on these. Exercise 29, page 491, before we go to not from word parts. Okay. So not from word parts, we have a metropia, or EM as it's abbreviated. Whenever you see E at the beginning of the word, sometimes it often means that that's the normal way. So in this case, we have normal refractive condition of the eye. So the actual reflection onto the retina and vision looks great. Intraocular lens, we talked about that. That would be an example of a fake lens put in by that procedure that we had just mentioned previously on the last slide, the pseudophakia. Miotic and Mediatic are opposites. So oftentimes you might get special drops to put in your eyes that were either going to dilate your pupil or constrict your pupil, and that's what these are. Miotic constricts your pupil, so it forces that iris to create a smaller pupil hole to allow less light in. Mediatic would be the dilation drops, for example, that you get when you go to the doctor. An optician is a person who fills prescriptions for lenses. So they're the one at the eye doctor filling the prescriptions, but they can't actually make those prescriptions. They get them from the optometrist who measures your vision, and then gives the optician the orders basically to fill. On here we have visual acuity, or VA. That's basically your sharpness of vision. We think of 20/20 vision or visual acuity. It's different for different people, but that's what that means. Not last, we have a couple of just distinctions just to make sure you clearly understand the difference. The ophthalmologist could be the surgeon who studies and treats eye diseases. So, for example, on that previous question when we had enucleation, they wouldn't clearly remove the eye in the doctor's office, but they are capable and a surgeon with which to then go and do an enucleation if they needed to. The optometrist is the one who's just doing the basic measuring. Looks at visual changes. They can measure things like pressure, and generally manages basic diseases, but they're not like the surgeon that would do operations on tear ducts and eyes. And then we have lastly the optician, who is the one who actually fills the lens prescriptions. Okay. Last but not least, in this chapter, we had a number of abbreviations. They were highlighted throughout, so just make sure that you do know them for the test once it rolls around. As always, at the end of the chapter, please, please, please work on those exercises that kind of pull everything together. So this is the exact same passage as found on page 498 in your book. But just practicing those words in context and figuring out what they mean in relation to each other. And doing the quiz at the end too, where it kind of pulls everything together, I think is really helpful in prepping for the test. You made it.